Hi, this is Dr. Harris at California Hernia Specialists. I want to talk just briefly about some of the benefits of a non-mesh repair for a hernia, whether that's for an inguinal hernia or for a ventral or umbilical hernia. Meshes that we use today are extremely safe. Obviously, there's been a lot of bad press and bad publicity over the years and decades on mesh, and some of that is certainly justified. But the meshes used for ventral, umbilical, and inguinal hernias today is extremely safe. It's used in the majority of patients, and patients have a great outcome from that. But that being said, there are some benefits of avoiding foreign body within patients. Some patients have autoimmune diseases. Some patients are just very, very sensitive to foreign bodies. And so those patients really would like to limit the amount of foreign body within their body. So, doing a non-mesh repair, again, limits the foreign bodies within patients, and can, for those patients, provide a very good outcome. It is important to emphasize that most likely in most studies, what's been shown is that non-mesh repairs do have a higher recurrence rates than a patient that had mesh. But again, it may be going from 1 or 2% to 2 to 4, or from 2 to 4 with mesh, 4 to 8 without. So those numbers are still fairly small, unless of course you're one that has that recurrence. But having a discussion with a surgeon that you're going to see, talking about again your expectations for after the surgery are very important. If you say, look, I am very adamant, my number one priority is to avoid a foreign body inside of me, and then my next priority is to have a long-term repair that isn't going to recur, well then obviously then maybe we go with the fact that we don't want to put a foreign body in you, knowing that the recurrence isn't as important to you. But again, if the patient comes in and says, hey, I just never want to go through this again, I trust the surgeon, that the surgeon has done a lot of these, then maybe we do use a mesh in those particular patients. But again, some of the benefits is no foreign body within the patient, less of a foreign body reaction within those patients. So that can be a benefit to specific patients who are concerned and have a propensity to having inflammatory reactions. So with specific patient populations, specific hernia populations, as we've talked about in other videos, those patients can be good candidates for a non-mesh repair. So hopefully this helps. Again, it's more of a discussion. We're here to try to help provide patients with what they're looking for. So if a patient's adamant that they want a non-mesh repair and we think that they're a safe candidate, then that would be an option for them here at our center. So we hope this helps. Again, the best option is for us to evaluate you in person. So if there's questions or concerns, you want to be evaluated for a non-mesh repair, please give our office a call. We're happy to help.